Mr. Santos, good to see you. How are you today? I'm doing well. Thank you for asking. Let's get right to the point, doctor. Why have my wife and I been unsuccessful in conceiving a child? I'm very glad that you came in for a follow-up, and it is unfortunate your wife cannot make it today. We ran several tests on you and your wife. Your wife is all clear. We observed no physical problems or hormonal defects with her. Your physical test came back negative, which is also a good thing. We decided to run a karyotype, also known as a chromosome analysis, on a sample of your blood, just to see if there are any abnormalities in your chromosome structure or number. And we found that you have a condition called Klinefelter syndrome. Wow, that's a lot to process, but I'm glad we've identified something. So what does this mean? Is this good or bad? Well, it's neither good nor bad because it's non-life-threatening, but it is the reason why you have been infertile. So what causes Klinefelter syndrome? Klinefelter syndrome occurs as a result of a random error that causes a male to be born with an extra sex chromosome. It is not an inherited condition. Humans normally have 46 chromosomes, and men have an XY sex chromosome, and women have XX sex chromosomes. But you were born with an extra copy of an X chromosome, therefore giving you the condition XXY. Okay, got it. So how does this affect fertility? That is a good question. So a man's testicles has two roles. One is to make a hormone called testosterone, and the other is to make sperm. Both functions are affected by Klinefelter syndrome, but the degree to which they are affected varies from one person to another. Men with Klinefelter syndrome usually have no sperm in their semen. This is because of the way that Klinefelter syndrome affects the testicles. The testicles of Klinefelter syndrome men are at their most active when they go through puberty. Following this, they become increasingly less effective at making sperm. Males with Klinefelter syndrome usually enter puberty normally, but by mid-puberty, they may have low levels of testosterone, small testicles, and the inability to make sperm. Okay, that makes sense. Was there any way to catch the defect earlier? What are some signs and symptoms for those who have Klinefelter syndrome? Yes, one sign that you do show, and that is common with XXY, is your diagnosis with a learning disability. ADHD, dyslexia, and dyscalculia, along with genitalia defects, like smaller size genitalia, are the most common signs, but don't always mean that you have Klinefelter syndrome. Don't get upset with yourself for not catching it earlier. Many men with Klinefelter syndrome are not diagnosed with infertility until they realize they're unable to father a child, which unfortunately is the state that you're in right now. I see. And what are some other risk factors and complications you see with this diagnosis? The risk of Klinefelter syndrome isn't increased by anything a parent does or doesn't do, but a number of complications caused by Klinefelter syndrome are mostly related to low testosterone. With your recent physical, you're not showing any signs of physical defects like body and facial hair loss, less muscular compared to other men, or an increase in belly fat. And you didn't report any feelings of anxiety, depression, or social and behavioral problems. You're healthy and you seem optimistic. I think you're going to be in good shape. Well, that's good to hear. What are some next steps we can take? Can my wife and I still have a baby while being infertile? Of course, there are quite a few different options available to you. One treatment is we can run tests and look for even very small numbers of sperm that are present in your semen. It may be possible to select these sperm and inject them into eggs taken from your partner's body as part of an IVF treatment. This form of IVF treatment is called intracytoplasmic sperm injection and can be a little invasive. Are there any less invasive options? Yes, there are. Many couples affected by Klinefelter syndrome choose to use sperm from a donor when trying for a baby. The clinic will explain the process to you, including how to choose a donor. Sometimes couples ask someone they know, a family member or friend, to be the donor. This is called known donation, and for this, the potential donor will need to be assessed by the fertility clinic. Some couples choose to adopt or foster, and many couples who can't have children choose not to do so. If this increasingly common life choice suits you and your partner, this is as valid a decision as any other. Thank you, Dr. Braley, for explaining all this to me. It's definitely a lot to take in, and I'll have to share all this with my wife when she gets back in town. You're welcome, Mr. Santos, and please check back in with us after you and your wife discuss. I know it is a lot to process and can be confusing. So here, take this information packet on Klinefelter syndrome. It's a basic overview of our conversation today, and there are some great resources highlighted in the packet that many patients with Klinefelter syndrome have used and reported helpful. Okay, perfect. I'll plan on reading this over with my wife. Thank you again for everything. I'll plan on seeing you soon. Of course, I'm happy to help.